Shalom, all praises to Yahweh, Ba'ashem Yahweh Shai, Ba'ashem Harakah Kadash. Double honors unto the apostles and elders of great millstone all well, and shalom to the hopeful elect. Um, this is news and prophecy, prophecy and news. Hey, I'm going to read the title of this article from The Guardian, and it reads, UK coronavirus crisis to last until spring 2021 and could see 7.9 million hospitalized. So now they're giving you the lowdown, man. They're giving you a foresight to see what is gonna happen, all right, and what's the intentions. So that the fact that they're saying that this is a crisis that could last for a year, all right, because presently we're in the spring of what, the year 2020, which Apostle Tahar through the Spirit and power Yahweh Hashem El Shai Hashem Harakah Kadash named befittingly the year of prophecy. Okay, so they're saying that we could have a year of this kind of these kind of things happening. All right. Now, if we're saying 7.9 million can be hospitalized, this means that a state of martial law, state of emergency could be implemented. Places can be locked down, curfew, limited rationing, registration of people, the RFID chip, re-administration of finances. There's a myriad of things that can happen off the strength of this. The fact that they're telling you within a year that, this is going to be a crisis. And that might even be them saying within a year, we're going to implement our new world order, all right? For those in the know. Anyway, let me read. Exclusive Public Health England document seen by Guardian says 4 in 5 expected to contract virus. All right, so that's basically you're saying 80% of people are going to contract this virus, man. All right. So the coronavirus epidemic in the UK will last until, but in the world, the WHO's declared it a pandemic. Okay, but it's an epidemic over here. So, you know where it's going to. All right. In the UK will last until next spring and could lead to 7.9 million people being hospitalized. A secret Public Health England briefing for senior NHS officials reveals the document seen by The Guardian is the first time health chiefs tackling the virus have admitted that they expect it to circulate for another 12 months and lead to huge extra strain on an already overstretched NHS. Okay? It suggests that the health chiefs are braced for as many as 8% of Britons becoming infected with coronavirus over that time. Professor Chris Whitty, the government's chief medical advisor, has previously described that figure as a worst case scenario and suggested that the real number would turn out to be less than that. However, the briefing makes clear that 4 in 5 of the population are expected to contract the virus. The document says that as many as 80% of the population are expected to be infected with COVID-19 in the next 12 months, and up to 15%, 7.9 million, may require hospitalization. So now they're saying 80% of the population can be infected by this. That means that with that information out, what are the public going to say? They're going to say, look, man, and this is what's been going on. Basically, the government's been lax with their approach to dealing with this quote-unquote crisis of coronavirus through intention, I believe, all right, in my personal opinion. Reason being is because what you have is the masses of the public turning around and saying, look, the government ain't doing nothing. They should have shut the borders to China years of time ago. They should have not let no one back in. They should have done X, Y, and Z. So now when the government tries to pick up on the slack that they've showed, all the people are going to basically, cause through fear, it's going to drive them to be at one with whatever the government wants to do, all right? So they can basically come down with a heavy hand, all right, and basically establish their new world order. The briefing sets out the latest official thinking about how severely the infection could affect both the public's health and that of the personnel in critical services such as the NHS, police, the fire brigade, and transport. So they're thinking about it on all across the board, basically. All right. So that means that what they're doing is they're then gutting the whole system as it stands right now, and they're gonna reestablish a new system to basically create safety and security amongst the people. All right, whereby they can have total control, and this thing, quote unquote, cannot jump to 80% of the population getting the virus. All right. So it's a whole a guise to establish that. It has been drawn up in recent days by the PHC's Emergency Preparedness and Response Team and approved as accurate by Dr. Susan Hopkins, PHC's lead official dealing with the outbreak. It has been shared with hospital bosses and senior doctors in the NHS in England. All right, and this is all spoke about also on Event 201. For the public to hear that it could last for 12 months, people are going to be really upset about that and pretty worried about that, said Paul Hunter, a professor of medicine at the University of East Anglia. A year is entirely plausible, but that figure isn't well appreciated or understood, added Hunter. An expert in epidemiology, I think it will dip in the summer towards the end of June and come back in November, in the way that usual seasonal flu does, right? I think it will be around forever but become less severe over time as immunity builds up. So with that being said, it's going to be around forever. That means that system that they're going to establish needs to be around for what? Forever, all right? The admission that the virus will continue to cause problems for another year appears to undermine hopes that the arrival of warmer weather this summer would kill it. All right. The document also discloses that an estimated and man, I had a flu in August, and it was the hottest day of the year, man. So I don't know what they're talking about. The document also discloses that an estimated 500,000 of 5 million people deemed vital because they work in essential services and critical infrastructure will be off sick at any one time during a month-long peak of the epidemic. The 5 million include 1 million NHS staff and 1.5 million in social care. So that means they're going to have to bring someone in, all right? But who? However, the briefing raises questions about how Britain would continue to function normally, warning that it is estimated that at least 10% of the people in the UK will have a cough at any one time during the months of peak COVID-19 activity. Under revised health advice Boris Johnson unveiled last Thursday, anyone with a cough should self-isolate for at least 7 days. The document also states that health service cannot cope with the sheer number of people with symptoms who need to be tested because laboratories are under significant demand pressures. All right. From now on, only the very seriously ill who are already in hospital and people in care homes and prisons where the coronavirus has been detected will be tested. Testing services are under such strain that even NHS staff will not be swabbed, despite their key role and risk of them passing the virus on to patients. So you see how this thing's unraveling, man. It can really perpetuate into a big situation. A senior NHS figure involved in preparing for the growing surge in patients whose lives are being put at risk by COVID-19 said an 80% infection rate could lead to more than 500,000 people dying. If the mortality rate turns out to be 1%, many experts are using as their working assumption, then that would mean 531 sluck here, man. You see it there, man. Around 500,000 deaths. But if Whitty's insistence that the rate will be closer to 0.6 proves accurate, then it would be around 300,000 people dying. Experts advising governments worldwide on the way epidemics grow and eventually decline say there will be a rapid rise in cases and a peak falling off away. Now, I ain't gonna read anymore, man. I ain't got the wherewithal to do it. But I'm just gonna jump to two scriptures, man. Two scriptures. This is Psalms 55:21. The words of his mouth were smoother than butter, but war was in his heart. His words were softer than oil, yet were they drawn swords. Now, what this is talking about Esau, okay? And those words that you heard, they're smooth words, but really they're words of warfare, words of the sword, right? Because essentially what Esau wants to do is basically put his sword to use, okay, with population control, all right, in terms of dealing with the Georgia Guidestones. But then also you have to understand as well is I mean that's the key point. What am I talking about? That's the key point, all right. Now, and then you have these dumb people that are walking down to eat. You try to tell someone that you can deal with this by way of natural remedies and whatnot, they ain't gonna listen to that, man, because the media's done a number on their brain. They're thinking the media, they couldn't be saying that it's that bad. They wouldn't say it's not that bad if it isn't that bad. All right, I'm gonna have to go, and ultimately it's gonna bring about what vaccines, the vaccinations, okay, and that's what's really gonna get the people, and it's gonna drive them to do what? Get the RFID chip, okay. But ultimately, this is what you gotta do, man. I'm gonna read on. It says, "Cast thy burden upon the Lord, and he shall sustain thee. He shall never suffer the righteous to be moved." All right.